Welcome, David Wiss here, registered dietitian, founder of Nutrition and Recovery. Today we're going to talk about trauma, eating disorders, and food addiction. This is a very exciting area of research. First caught my attention when I saw the editorial by Dr. Brewerton, which suggested a link between PTSD and food addiction, suggesting that overingestion of highly palatable foods can be a strategy by traumatized individuals to numb themselves from the unpleasant feeling states and memories. In other words, highly palatable food can be just like other substances that alter brain chemistry and consciousness. In the same journal, there was an article linking PTSD to unhealthy weight loss behaviors in women. This looked at dieting behaviors including pills, laxatives, diuretics, purging, restricting, classic eating disorder pathology. These authors found that there was not a link between PTSD and BMI in these women, likely because of all these compensatory and dieting behaviors. These authors suggested that the PTSD symptoms might initiate a process of overindulging in unhealthy food in an attempt to compensate for the way trauma-induced memories make them feel. This can then lead to negative feelings about weight gain, body dissatisfaction, and then possibly lead to eating disorder pathology. This large study from the Growing Up Today study looked at associations between PTSD and binge eating. And you can see here from the highlights that as the number of PTSD symptoms go up, the risk for binge eating goes up. And here with 4 to 7 symptoms, we have a risk ratio of over 2. Once you add depression with PTSD, the risk of binge eating goes up to as high as 3. Clinicians treating those with traumatic stress symptoms should be aware that many people, particularly with PTSD and depression, will have comorbid eating behaviors that put them at higher risk. Another large sample study looked at not only trauma in general, but the specific type of trauma, whether it had been a combat-related trauma, life-threatening accident, natural disaster, physical or sexual assault. In this study, it was shown that 40% of women with bulimia nervosa reported a history of rape or sexual assault. About a quarter of men reported having been beaten by their parents. And the authors suggested that EDs and PTSD has a lot of common genetic and biological vulnerabilities. One of particular interest is the hypothalamic pituitary adrenal axis. This HPA axis will be an area of active investigation in coming up years. In summary, the authors suggested that it wasn't just women, but also men that have links between trauma, PTSD, and then higher rates of eating disorders. Abuse victimization in childhood has also been linked to food addiction. In this study, it showed that severe physical and sexual abuse were associated with a roughly 90% increase in food addiction risk. Perhaps that the uncontrolled eating in response to distress is the pathway. The authors suggest that future work should look at the pathways from abuse to weight gain and identify the critical periods of vulnerability, meaning the timing, as well as other intervention strategies that can be used for prevention and treatment. PTSD has been studied a lot in veterans. And this particular article from 2012 showed the link between disordered eating and PTSD in veterans, and they suggested that while there's classic eating disorder symptoms, a far greater percentage of these people have what we call disordered eating, that is abnormal eating that don't meet full criteria for an eating disorder, but still cause functional impairment. PTSD and food addiction has been looked at in other veteran research. This particular study looked at the role of emotion regulation. The authors suggested that PTSD is most strongly associated with EDs characterized by binging and or purging, and that the associations they found with PTSD and emotion regulation may be a very important area of future investigation. This diagram shows the links between PTSD and not only eating disorder symptoms, but food addiction. And there are coefficients, in other words, correlations that have been studied between them that have been documented here. I think the important take home from this is that there's a lot of overlap between eating disorders and food addiction, and PTSD is a perfect example of how that kind of overlap can exist, and it exists at a biological level. There's links between childhood trauma and food addiction, as well as binge eating. This study showed that the severity of the childhood trauma was associated with the severity of food addiction, and this was after controlling for all the other variables, suggesting that childhood trauma is a crucial factor for the development of food addiction. Patients with food addiction and binge eating may use food to prevent or relieve the negative emotional states which arise from trauma, and the future research suggested by these authors suggests needing to clarify how different types of childhood trauma can selectively affect various types of dysfunctional eating patterns. So future research should look at the difference between PTSD and complex trauma, also known as little t trauma. The type of trauma is going to be important. The age of the developmental sensitive periods will be important, considering the type of eating disorder linked to the traumatic experience, the interaction with addiction, whether it be food addiction or drug addiction, alcoholism, certainly the role of the HPA axis considering the vagus nerve, and there's been all this other recent research about the microbiome linked to trauma as well as eating disorders and addiction. Lots of exciting stuff going on. Stay tuned. If you have questions or comments about this stuff, please leave them below. I'd love to hear from you.